Amplifying the Care, a cardio-diabetes awareness initiative with Dr. C Santosh Kumar.
Hi everyone, I am Dr. C Santosh Kumar, consultant interventional cardiologist working at Yashoda Hospital, Malakpet, and I do have a clinic in Vanasthalipuram, Swasti Clinic, where I will see cardiac patients in the evenings. Today I am going to discuss about very common cardiac problem that nowadays people are suffering with, that is heart failure. So heart failure, what is heart failure? Who will develop heart failure? We will discuss briefly about this condition. Heart failure is a condition where heart is unable to pump adequate blood to the entire body. So where people will get easy weakness, fatigability, breathing discomfort, swelling of the body, weight gain, all these are the symptoms. Who develop heart failure? This is very nowadays become very common because of the metabolic disorders and lifestyle disorders. That is, patients with hypertension, patients with diabetes, increased risk of developing heart failure. When hypertension and diabetes are uncontrolled, they may lead to heart failure. And coronary artery disease, that is another cause where we routinely call as heart attacks and heart blockages. This type of disease, the cardiac disease also can lead to heart failure. And sometimes infections, some viral infections which affect cardiac muscle may lead to heart failure, weakness and heart failure. And because of some metabolic causes, sometimes congenital problems where the developmental heart related issues may also present as heart failure. Another entity which was very common earlier days is valvular heart disease. So rheumatic heart disease was very common previously, which these patients also present with heart failure. So coming to age-related valve problems, that is degenerative valve problems, particularly in elderly, aortic valve and mitral valve can cause dysfunction of these valves, so which may lead to heart failure. So wide variety of population are at increased risk of heart failure. So coming to how to identify this heart failure early. Okay, any person who is unable to do his routine activities or getting breathing discomfort or easy fatigability while doing routine works is an early indication. And for example, if the patient's weight is increasing recently and if he's unable to lie down flat, so these patients will get more discomfort on lying down flat. So because edema in the lungs, they will get more breathlessness while lying down. So this may be the early sign sometimes to identify heart failure. So how do we identify whether the patient is suffering really with heart failure or any other condition? So we should do some routine investigations like heart-related ECG, 2D echo. This will identify the cardiac function, and some biomarkers are there where the blood test will give the information about the load on the heart. That is pro-BNP or BNP. These are commonly used blood tests to identify heart failure patients. And sometimes X-ray, chest X-ray will also will help in identifying the severity of the heart failure. Clinical examination will help in identifying heart failure. If the patient is very sick and unable to breathe, unable to talk, in that situation, he needs admission and needs intensive care treatment, so that once he stabilizes, we can identify the cause and treat accordingly. So identification of heart failure is very much important to save majority of patients. What are the indications of worsening of heart failure? For example, a patient already had heart failure, we have treated and he is on medications, and how can he identify whether it is worsening or not? So frequent checkups are very much necessary, and sometimes we follow with routine blood tests like BNP frequently, and any increase in weight or breathing discomfort, unable to lie down in the night, discomfort midnight, like cough, breathlessness, all these are indication of worsening. At that time, you have to consult the cardiologist to prevent a severe episode. Okay. So what is the necessary things a heart failure patient should do during follow-up is they should check their weight frequently. That will help in identifying any deterioration in the condition. and any type of fatigability, weight gain, breathing discomfort. Okay, so they have to consult the cardiologist to get a early identification of any worsening.
Issued in public interest by IPCA Laboratories.